Olympian water testing, giving you the best in water analysis. Today we're looking at the CDC community water fluoridation and a message from the Surgeon General's statements on community water fluoridation. It's interesting to see that this has been going on for quite some time. Since the 1950s, the U.S. Public Health Surgeon Generals have committed his or her support for community water fluoridation, and below are endorsements supporting community water fluoridation for various Surgeons Generals. And I think this is interesting to see the one from 2016 and some more recent ones as well. So we can get an idea based on their perspective what water fluoridation is doing. So 2016 Surgeon General statement on community water fluoridation. Over the past 70 years, community water fluoridation has contributed to dramatic declines in both the prevalence and severity of tooth decay, leading the Centers of Disease Control and Prevention to name it one of the 10 greatest public health achievements of the 20th century. Alongside immunizations, family planning, tobacco control, and other motor vehicle safety, water fluoridation is the best method for delivering fluoride to all members of the community, regardless of age, education, income level, or access to routine dental care. Fluoride's effectiveness in preventing tooth decay extends throughout one's life, resulting in fewer and less severe cavities. In fact, the generation born over the past 70 years has enjoyed better dental health than the one before. And that's the very essence of the American promise. Progress in this issue over the past 70 years has been undeniable. But we still have work to do, because we know that so much of our health is determined by zip code rather than genetic code. That's why creating a culture of disease prevention through community efforts and ensuring health equity for all is one of my highest priorities. Community water fluoridation helps us meet these goals, as it's one of the most cost-effective, equitable, and safe measures communities can take to prevent tooth decay and improve oral health. Advocates and community leaders have fought to make water fluoridation a reality in communities throughout our country. Today we applaud their efforts, but our work is far from finished, and we will not rest until every community is equipped with the many tools they need to help their residents live healthy, happy lives. And that is Vivek H. Murthy, MD, MBA, United States Surgeon General, which is very interesting. We also have different ones as well. In 2013, they wrote about that as well, saying fluoridation's effectiveness in preventing tooth decay is not limited to children, but extends throughout life, resulting in fewer and less severe cavities. In general, generation born since the implementation of water fluoridation has enjoyed better dental health than the generation that preceded it. As then Surgeon General David Satcher noted in Oral Health America, a report of the Surgeon General, May 2000, community water fluoridation continues to be the most cost-effective and practical way to provide protection from tooth decay in the community. The U.S. Center for Disease Control and Prevention has recognized fluoridation as one of the 10 greatest public health achievements of the 20th century. This year marks the 60th anniversary of community water fluoridation. I join with previous Surgeon Generals in acknowledging community water fluoridation as an effective public health strategy and recommend its continued use and expansion to enhance the oral health of all Americans. So we can see that the Surgeon Generals hold water fluoridation, community water fluoridation, in high regard. And while this mineral can have some benefits on teeth, it can also have some issues when it gets very high in the water. That's why it's always a good idea to periodically test your water for fluoride.